One thing when I study the role of religion and mental health for Black youth, and so one of the things that when you think about mental health, there in many religious communities, there remains a stigma around how we understand mental health. Do we even acknowledge it? And one of those things really brings us to focus on the theological underpinnings on how mental illness and mental health are conceptualized and approached. And so, for example, there's a religious community that I know of that has a professional counselor on their staff to provide treatment to both congregants and non-congregants alike. So that's an example of a place where the espoused and the articulated and practiced theology really shows wellness for the whole person beyond just religious and spiritual support. There are other places, for example, in other religious groups, especially in minority group predominant congregations, where mental health has more of a stigma. And so those are places where you're not going to find as many resources for mental health to be understood from a diverse perspective. So those are two examples of the spectrum in which we find ourselves thinking about. The other thing I wanted to just mention is that a lot of these questions are at the intersection of theology and resources. So not only you may have a theology that allows you to fully express your space as a fully inclusive place for people with differing abilities to be involved and to be seen and to be known. But for example, if you're in a low resource area, you may not have the structural and the financial support for that disability to be even something feasible. And so those are some things that I think that are really important when we think about how these questions, how your original question really shapes how people go forward in this area.